best friends, let's talk about some tips for new nursing students. Welcome, my name is Yulia and I am a senior nursing student graduating in just 6 months. So I have been through 2.5 years of nursing school already. Now let's talk about some methods that I have used that have helped me get successful in my program so far and that I am going to continue using on until I graduate. One of the best things that I can tell you is do not cram. Do not try to study for the test last minute or study for this or that last minute. It's not going to stick. You're not going to understand it. It's not going to make sense to you. I once heard that it takes about 7 times going over one subject for it to actually stick in your head and for it to make sense. Now, when you're in nursing school, you don't want to just aim to memorize, you want to aim to conceptualize. And what that means is you want to make sure that you are understanding the concepts that you're talking about and you can apply it to a patient scenario. So a good way to study would be to go over the material and try to connect it to what a patient might look like and how you would then treat that. So how is this going to look? Before you even get to class, you're going to study the material ahead of time. You're going to gather the information the way you like to gather the information and see what you can find. You're then going to attend class, you're going to participate in class, and you're going to actually try to do some active recall. Afterwards, you're going to rewrite your notes and go over sort of the things that you missed. You're going to let it rest for a little bit. Maybe a week or so before the exam, you're going to go over all your notes again. Make sure that you can answer all your learning outcomes. Where you'll get your learning outcomes is either through your school website's learning modules, through books, or just online with like what questions should you know about this specific material. So we just talked about that we're not going to cram for our classes, we're not going to cram for our exams, but how are we actually going to study for the test that we're about to take or what we're about to study? Like I mentioned before, in nursing school and in nursing just in general, you want to aim to conceptualize and make the subject make sense rather than just memorizing. So what that's going to look like for you is going to be different what that's going to look like for me. For me, I really enjoy such as additional learning materials or watching videos. Videos are great. I supplement usually with the textbook because the textbook is usually very, very detailed. And then I try to find sort of outside resources and then I connect it to the patient. I think about, okay, what will my patient look like that has this condition? What will I be looking out for? How will we then treat it? Now, there are some other methods out there that might work really well for you, such as you might enjoy reading better. You might need to write things down. You might need to type things out. You might need to use active recall on a whiteboard. And that's just something that you actually need to find yourself. And there are so many methods out. On that note as well, we need to be testing our knowledge constantly, especially before exams. So this means you need to be doing practice questions and case studies. So these you can find on sites such as nurse.org, or you can make ChatGPT make you questions. You can ask ChatGPT to make them harder on a specific subject. There are Quizlets. Osmosis is great because you can make your own test bank. So there are so many resources out there that you can sort of compile into making yourself a little quiz. On a different note, to stay sane in school, you're going to want to make some friends. You're going to want to find a study group or just a friend group that you can bounce ideas of, that you can study together. Really find yourself a core group of friends. This doesn't need to be 50 people, 20 people, doesn't even need to be 10 people. If you can find yourselves 2 to 3 to 4 friends that you can bounce ideas of, study together, somebody that you can trust, somebody that you can really feel like that you can connect with and really understand the way you guys work well together. Now, there will be study groups that if you try to go to a study group, everybody's going to be yapping the whole time. That's not productive. I focus on staying away from those, but I do value some core friendships that are really, really, really important to stay in touch with just to make sure that you're on the same page. It's also really nice to just have somebody that knows what you're going through, that is going through the same thing you are going through. It makes you feel so much less alone, and it's just so nice to have somebody that's there for you. Another thing that I think is very important is get involved in school, join a peer mentor group, become a peer mentor. There's usually some sort of a nursing association in school There's lots and lots of volunteer opportunities, whether that's with your sim lab or through the hospital or just in your cohort. I definitely recommend just to get involved and stay active. You never know what will happen from those opportunities, who you'll meet and what you'll connect with. And on that note, my last note is don't be shy to ask the question. Like I mentioned, you never know what opportunity might come to you if you just ask the questions. Connect with your teachers. Ask them if there's any opportunities for you, or ask for clarification on a question that you might have. Ask your nurses around you that you are shadowing or mentoring with. Ask them if they know of any sort of resources for you. Ask them if there's any skills that you can watch them perform or that you can perform yourself. Try to ask questions to other members of staff, such as aides or management, respiratory therapists. Just try to gain knowledge and connections from everybody, because you never know when a question might lead to a relationship that might give you an opportunity down the line. And lastly, let me leave you with, enjoy the process. Before you know it, you're going to be done, you're going to be graduated, or you're going to be 6 months away from graduating, and you're going to be wishing that you had enjoyed the process more, that you had cried less, that you had stressed less, because everything will be fine as long as you're organized, as long as you stay on task and focus on yourself as well as the material. You are going to be just fine. So enjoy the process, enjoy the friendships, enjoy learning, because this is definitely a hard career to go into. It can be very, very, very stressful. So enjoy everything that it has to offer, because we chose it for a reason. I have lots more to share, and if there's anything specific you would like to see, please shoot me a comment or a message, and you can find me everywhere under my social media handle, Julia Gretters1995, and I look forward to connecting with you.